Hi, my name is Gaetan Chevalier, and I am Research Director at PsyTek Labs. This video is about the results we obtained testing 6 participants with type 2 diabetes using the AVACEN device. The title of this project is Effects of the AVACEN Treatment Method on the Brain and Microcirculation of Participants with type 2 diabetes pilot study. The project was performed by PsyTek technicians, and the report of which this is derived was written by myself. So this project, as I said, had 6 participants, 2 males and 4 females, with a medical diagnosis of type 2 diabetes based on their lab results. They were between 18 and 75 years old. The intervention was a 20 minutes AVACEN treatment. To measure the effect of the AVACEN device on participants, we used the following equipment: the wavy brain mapping system, the Menla scan, and the gas discharge visualization device. The brain mapping system we used was the WAVY, a 19-channel brain mapping system that can measure the auditory P300 wave, a measure of brain response speed and attention resources. This system can also measure physical reaction time, which is a measure of speed in response to an audible odd tone, which assesses brain-body coordination level, coherence, which is the level and quality of functional connectivity between brain regions, trail making, a standard measure of brain function, including psychomotor and visual scanning, the theta over beta at CZ, a ratio that measures cortical arousal and brain function, and F3 over F4 alpha power, a measure allowing determination of the level of anxiety and depression. This is a P300 scalp topography map of participant 4, a 47-year-old woman. These images show a top view of the brain with the front part, the face, in the upper part of the image, and the back of the head at the bottom of the image. The left picture shows her brain before the AVACEN treatment. As you can see, it had very low activity. After the AVACEN treatment, her brain was very active, especially on the frontal regions in the middle of the brain, which is the red regions. From this image, there is no doubt that the AVACEN treatment activated her brain. This slide shows brain coherence before and after the AVACEN treatment for 4 brain waves bands: the delta band, the theta band, alpha band, and beta band for participant number 2, a 74-year-old female. The perspective given is again to look down at the top, of the head with FP1 and FP2 being in the frontal regions of the brain, and O2 and O1 in the occipital region of the brain. Without becoming too technical, we can think of coherence as a synchronization between 2 electrode sites and may be interpreted as an expression of their functional interaction. Hypercoherence is when brain sites are not functioning in efficient interdependent fashion. They have too much crosstalk. They are overly connected or locked together. Hypocoherence, on the other side, is called poor inter-site interaction and is associated with diminished cognitive efficiency. The red lines between the two sides indicate hypercoherence, while the blue lines reflect hypocoherence. Beta brain waves are normally dominant in a person awake, alert, with normal level of consciousness and brain function. Theta brain waves show up in deep relaxation, meditation, and mental imagery. Participants were awake with eyes closed during their brain scans, and so the most relevant results are those presented in the alpha, the relaxation phase, and beta, normal brain activity bands. As you can see, before the AVACEN treatment, participant 2's brain was in extreme hypercoherence, involving most of the brain sites measured and for all frequency bands. The brain, was so much hypercoherent that there was no clear dominance of any frequency band. After the treatment, the brain became hypocoherent, allowing the brain to calm down. Hypocoherence was a bit more pronounced in the alpha and theta bands, an indication of brain relaxation. This enormous change in brain coherence suggests a substantial improvement in cognitive efficiency and attention. So now, if we look at next slide, this slide presents P300 screening scores for participant 2. Physical reaction time is a measure of functional speed in response to an audible odd tone. It is about brain-body communication speed. Physical reaction time was slow before the treatment and went into the normal range after the session, indicating an improvement in brain-body function communication speed. Trail making is a standard measure of brain function as it relates to psychomotor and visual scanning. The time taken to perform trail making test B was too slow before the AVACEN treatment and went into the normal range after the treatment. Again, an indication of improvement in brain function. Auditory P300 is a measure of brain response to speed and attention resources. P300 slowing and or a reduction in voltage may signal changes in cognitive function. The slowing of the audio P300 delay is a clear indication of a change in cognitive function. This is due to the AVACEN treatment, no doubt. People with high theta-beta ratio at CZ may present as inattention, while others may benefit from cortical arousal. The initial high theta-beta ratio at CZ that decrease after treatment is an indication that participant 2's brain's cortical arousal decreased, indicating better attention. Finally, researchers discovered that calculating the F3 over F4 ratio relative power, F3 over F4 relative power ratio in the alpha band means processing information in a positive way for an increase, while a decrease in the ratio indicated a more negative processing mode. Participant 2's substantial increase likely means a more positive way of processing information after the treatment. The next slide is about the MENLA scan. The MENLA scan is a composite of 4 devices, which include those: the galvanic skin response, defined as a change in the electrical properties of the skin, heart rate variability, the physiological phenomenon of variation in the time interval between heartbeat, a sophisticated measure of autonomic nervous system function, the digital pulse wave analysis, digital analysis of photoelectrical plethysmography, which displays a contour of the peripheral pulse waveform related with the volume change in artery, and is able to monitor cardiovascular and microcirculation health, and bioimpedance that can measure body composition such as water retention and fat mass. It can also be measured, used to measure with more sophisticated analysis to measure the production of ATP from organs, which is actually the energy source of the body. So I will stop there because I'm getting too technical probably. But it's all in the report. Slide 8 shows an example of a MinGlass scan results for participant number 1, the 70 years old man. You can see great improvement in the cardiovascular score and in the autonomic nervous system score, ANS score. The other scores did not change significantly, remaining in the same zone, moderate or good. Now, let's talk about any other device that we used, the third device, the GD gas discharge visualization system. Slide 10. This is slide 10. So the GDV actually measures a person's bioenergy from the visible light emission forming a glow around the fingers of a person using a method called Kirlian photography. This method has been developed in Russia and used in the West since the 90s. The glow around the fingers is processed by a software to produce a glow around the body, as can be seen here. To enhance the glow, false coloring is added by the software. Two important parameters that are measured from this are the area, which represents the size of the glow, and symmetry, which represents the left-right balance in the glow of the left side and the glow of the right side of the body. To be considered having enough bioenergy, a person needs to have an area of at least 14,000, which is actually in camera pixels. We go deeper about this into the report. And a symmetry of 80%. The result presented here is for participant number 1, a male, a 70 years old male. There is no change in symmetry, but one can see the area increase from 17,798 to 19,465, an increase by 9.4%. An increase by 10% is considered significant. So we can say that this is quite close to a significant increase. What is interesting, though, is that all 6 participants showed an increase in area after the AVACEN treatment. And so that is very significant. And it shows that the AVACEN increased bioenergy of people. In conclusion, all 6 participants experienced an improvement in brain function. All of them also showed an increase in bioenergy. 2 participants showed a change in cardiovascular function. The cardiovascular system is likely a long-term effect. What I mean by that is that the cardiovascular system is a huge system. The body is a very physiological system. And to do a major impact on that system, we understand that it will take more than one measurement. However, we've seen already interesting changes, and that doesn't negate short-term effect that has been seen in the past using other methods, especially with the capillaries. So that's why we think that a longitudinal study would reveal the effect on microcirculation and cardiovascular function much more clearly. This presentation is based on the following report: Chevalier-Clark Cation, effects of the AVACEN treatment method on the brain and microcirculation of participants with type 2 diabetes pilot study. This study was done in October 2021. This research project was done under the supervision of Biomed IRB of San Diego. Thank you for your time.